Hello everyone, my name is John Lowe. I'm a PGY3 Emergency Medicine resident here at OSU Medical Center. Behind the camera we have Dr. Josh Burton and Jennifer Briggs. You might hear some voiceover from them during this video. We're just going to film a quick intro video to the facility, kind of get you guys oriented to what you're doing on your rotations here with us. So right now we're standing in the north lobby of the hospital. This is where you'll be checking in to come on to your rotations here. So you'll come in these front doors, there'll be a nursing station here that you'll get your temperature checked and badge in, and then we'll proceed to the south side of the hospital for the emergency department. So we'll go down this hallway. You'll be looking for the second hallway on the left. Come here to a set of double doors. When you guys come to check in for the rotation, I don't know if your ID badges have access. I don't believe they do, but they'll give you a code to access to this panel that'll open the doors here. Right now I'm standing in front of room 1, our trauma and resuscitation bay. This hallway that we're on is our 4 main resuscitation rooms. So we'll go ahead and step into room 1, kind of get oriented to those. When you walk in to the room, you'll see we have our stretcher. Along that back wall there, we have our trauma Pyxis. So if you need anything from chest tubes, endotracheal tubes, we have our cric kit, we have our intraosseous kits in there. Everything that we'll need for any type of trauma or acute medical resuscitation will be there. We have our rapid infuser over there. At the head of every bed in rooms 1 through 4, we'll have our airway station set up. So we'll have our airway box that will have your standard laryngoscope with your Mack and Miller blades, your bougie, your endotracheal tubes, everything you'll need to perform an intubation will be there with suction and your suction catheters at the top of the bay there. We also have our glide scope and our crash cart. So that's kind of the setup of room 1. If you're ever in the department and you hear an overhead page, straight back or patient to trauma 1, then politely excuse yourself and come in here because we'll be doing an acute resuscitation. So we're standing here on the northwest side of the emergency department here. So we'll have rooms 5, 6, and then down this hallway to my left, you'll have rooms 7 and 8. These are kind of our general medical rooms, general chief complaint, kind of bread and butter emergency medicine will go into rooms 5 and 6. 7 and 8 over here are our pelvic rooms. They'll be used mainly for female abdominal pain complaints. We'll come down this hallway here, we'll pass rooms 9 and 10. These can be used for general medical complaints, but they're also our lockdown rooms for any of our psychiatric emergency patients. Continuing on, we'll have rooms 11 and 12 here on the left as well. These can be used for general emergency complaints as well as overflow abdominal complaints for additional pelvic rooms if we need them to be. So we'll step here into room 12 just to kind of show you a general layout of one of our medical rooms. PPE is on the wall here. Monitor any of your equipment that you might need. Oxygen, that kind of stuff is on the back wall here. In these side tables complaints, we have our chuck pads if you're ever needing to do any type of laceration repairs. Here on the wall we have our tongue depressors, our some more PPE. Up in these cabinets we'll have gowns, sheets, towels. Here is if you ever need to use hand a patient a bedpan or a urinal. Then down in these drawers we'll have gauze pads, tissue paper if you need to give somebody Kleenexes or something like that, tape, and other essentials are going to be in these drawers. Sharps container is on the wall. So now we're standing on the northeast corner of the emergency department here. We have our rooms 13 through 17 on the back hallway here. These are our negative pressure rooms, so every room back here with the door shut can be an isolated negative pressure. Their setup is generally the same as any of our medical resuscitation rooms. They're used generally for any just kind of general generic emergency medicine complaint. However, right now we're using them as our isolation unit negative pressure rooms for the coronavirus. That's subject to change as all of that goes away or adapts as we kind of adjust for that. Right now we have our staged PPE carts outside of each of these rooms. So we'll kind of walk this way. We'll see room 13 and 14 here. We'll take a look at one of these PPE carts. If you come here, we try to protect our students as best we can, but we're still wanting you to get experience, so we want you to kind of see patients as well. Top, we'll have N95 respirators. We have our reusable, washable gowns, and then face shields in the bottom of these. Gloves are going to be in these additional brown carts. Make sure that you're taking the time to don your PPE appropriately, protect yourself at all times. Room 15 and then 16 and 17 will be back here in the corner. This is our west nursing station. During the day when we get into our surge time frame, we'll have nurses back here that'll be manning these back rooms. So we'll show you where our fast track overflow, where our non-emergent complaints, kind of more of our urgent care things get placed at times. We'll come out the east doors of the emergency department here into our ambulance entrance bay, and then you'll walk down here towards the ambulance exit. You'll notice a door here to your right as you're walking in that becomes the opening into our fast track. There'll be a nurse standing here at the nursing station to assist you with these 4 rooms. We have rooms D, C, B, and A, kind of backwards around this way. And like I said, this is where our less urgent complaints come. You'll see sore throats and minor abscesses, things that can get moved in and out of the emergency department fairly quickly here. All right, so now I'm standing inside what we call our Fishbowl. This is our resident and attending workstation. So if you look onto my right here, screen left, you'll notice this bank of computers. This is where the students and residents will sit. And then here on your right will be the attending side of the Fishbowl. So we always have at least 1 attending here. During the day, we end up having 3 attendings, usually between 4 and 5 residents, and then students will be in here. So we'll be able to kind of work together, and we'll explain the process as you guys get closer to your rotation. Lastly, we'll show you the resident didactic room. So we're standing here again on the east side by the east nursing station. You'll see these double doors here behind me. So we'll go through these doors. Down the hallway straight in front of us. And it will be your first door on the right. When you arrive, your badges will not let you into the resident room, so just knock and someone will let you in. And that's our didactics room.
The last thing we want to show you is how to use the T-sheet here in the emergency department. When you arrive to the emergency department on your first shift, there will be a stack of these located by the Fishbowl. The idea behind having these T-sheets available to you is to help you obtain a detailed history and physical exam, build a broad interventional, and ultimately help you to deliver a clear and straightforward presentation to the attending physician. Here's an example of one that is commonly filled out by us as residents. We typically use the OPQRST mnemonic to obtain an accurate history, but you're more than welcome to use what you like. Down the left-hand column, you see the past medical history, past surgical history, social history, family history, allergies, meds, and primary care provider. Sometimes you can get stuck spending a lot of time in this portion of the patient encounter, but remember, this is the emergency department and we like to keep things focused on the chief complaint. Moving down to the next portion of the T-sheet is the review of systems. Here you can include any pertinent positives or pertinent negatives you find based on the chief complaint. Under the review of systems is the physical exam portion. Here you can note any positive or negative findings you obtained during your exam you want to include in your presentation. I usually like to use this section of the T-sheet toward the end of my patient encounter to make sure I performed everything that I needed to. The bottom right corner of the T-sheet has a place for your impression and plan. This section should be completed by both you and the resident you're working with. Here you can talk about a differential diagnosis, what lab studies you want to do, what medications you want, or if you want to perform any imaging studies. This is also a great time to learn from your resident, so make sure to ask lots of questions so you really understand the workup. Alright, now that you have your T-sheet filled out and have discussed your plan with the resident, you're ready to give a clear and straightforward presentation to the attending physician. Alright guys, if you have any questions prior to our audition, don't hesitate to reach out to your chief residents or the student liaisons. We're here to help you in any way we can to make sure you have a positive experience here at OSU. Our information will be provided in the attached orientation email should you need us. Thanks again, and we look forward to working with you.